that most of us that were trained in reproductive endocrinology in the last 30 years were not trained in minimal stimulation or natural cycle technique. It's really a technique that evolved out of Japan and caught the interest of a few clinicians that started to test it and see the benefits of it and then start to use it widespread. But unfortunately, it's not taught to new fellows in fellowship training for reproductive endocrinology, and it's not something that's discussed a lot. And sometimes when someone that's been in practice for many years hears about minimal stimulation or natural cycle IVF, they hearken back to the days, 20, 25 years ago of techniques that were used in Australia for in vitro maturation for natural cycle IVF and the low success rates of that technique. Well, it was a different time. It's not anywhere near what we're doing today, and it's like comparing apples and oranges. So saying that minimal stimulation or natural cycle IVF is not as successful as conventional or standard IVF, going back to data that dates back to the early 1990s, is not relevant today and is not current with the techniques that we have today and the laboratory culture techniques and the overall success rate that we see with minimal stimulation and natural cycle IVF.